If you are a senior on Social Security or disability benefits and haven't received a letter from the Social Security Administration letting you know about the new changes that are coming up in April the 14th, you are not alone, because the Social Security Administration has not sent out letters alerting seniors and people with disability about these sweeping changes that are going to affect how you interact with the agency regarding your benefits. I am going to explain all of that to you. And then there is breaking news about surprise payments. If you've received $6,000 in your bank account or in the mail from the Social Security Administration, do not destroy it. It is legit. I will explain why. And we've been hearing from seniors saying that they've received extra cash this month, but do not know why. I have all the details for you. Now, watch till the end of this video, because if you are on Medicare right now or are turning 65 soon, learn how to reduce your Medicare costs by up to $1,100 a year. I will share the details at the end. Now, a little bit about me. I am Kwame Kwade. I am an entrepreneur and personal finance expert. For 15 years now, I've been creating content helping seniors get the benefits they deserve. We started with websites on Social Security, food stamps, Medicare, and Medicaid, and now we are adding video content. I am also an adjunct professor. I teach entrepreneurial finance to graduate students at one of the most prestigious universities in the United States. If you're new here, hit the like button, hit the subscribe button, because we appreciate your support. And as always, I want to know where you are watching this broadcast from. Let me know in the comments below. Give me your city and your state. So let's dive in. So what is happening with these sweeping Social Security changes that are going to affect everyone and how you interact with the Social Security Administration? And this is a critical update, and there are things that you need to do before April the 14th to prepare. The original deadline was March the 31st, but they got so much pushback because it was not enough time for people to take action. So they moved it to April the 14th. So, what are these new rules? Well, Social Security policy changes are here, and you have to understand how this is critical to your benefits and how you interact with the agency. The new in-person identity verification rule now takes effect on April the 14th instead of the March the 31st that was originally communicated. This delay offers additional time for seniors and other affected individuals to prepare the new requirements and understand how they might be impacted. Now, who is exempt? Well, Medicare, disability, and SSI recipients are exempt from in-person verification if they cannot complete the process online, which is a big change and a welcome change. These exemptions aim to protect vulnerable populations who may face significant barriers to in-person verification. These changes aim to reduce fraud, but will also create challenges for seniors and vulnerable populations. Understanding the impact these changes from the Social Security Administration is crucial to ensure you continue to receive benefits you are entitled to without interruption. So, what are the changes that are happening? Well, there's a couple of them. The first one is retirement and survivor benefit applicants must verify their identity in person if unable to do so online. So, if you're applying for Social Security or survivor benefits, you have to verify your identity online. If you cannot do that, then you have to go in person. These requirements aim to reduce fraudulent claims, but also place an due burden on people without internet access. And starting March 27, there's a new rule that is also coming into effect. Actually, it is going back to an old rule that was modified. The Social Security Administration will withhold 100% of benefits to recover overpayments for new cases. This change in policy significantly increases the financial impact on beneficiaries who have received overpayments requiring immediate and full repayments. And then, of course, you know about the cost of living adjustment that happened earlier this year, 2.5%, which was very disappointing to a lot of seniors, which moved your benefits by an average of $40, the average Social Security benefit, to $1,976. And then there is staffing reductions. They are closing offices. They are laying off people at the Social Security Administration due to Doge and Elon Musk. So the SSA is cutting thousands of jobs, closing field offices, impacting customer service availability. As a result, Beneficiaries may experience longer wait times when seeking assistance with their benefits, further complicating the process. So, who is impacted by all these changes? Well, those applying for retirement and auxiliary benefits must verify their identity in person if online options fail. The new rule adds a layer of complexity, especially to those who are unfamiliar with how to use the internet to verify your identity. Anyone receiving an overpayment after March the 22nd, 7th will face full benefit withholding until repayment is complete. This is a drastic change. So this was the rule originally, and then the Biden administration, after a lot of blowback from Congress, changed it to 10% withholding, and then the Trump administration is bringing back the 100% withholding, which is going to create a whole lot of pain financially for a lot of people. Now, SSI recipients undergoing redetermination audits may face huge scrutiny. These audits could lead to benefit adjustment or termination if income or asset criteria are not met, affecting vulnerable individuals. And then those without online access, seniors without access to Social Security Administration's online system may face longer wait times or travel burdens. A lack of internet access will force those seniors to rely on in-person services, which are becoming less accessible due to office closures and staff reduction. So they are pushing people from online and over the phone. Remember, 40% of seniors are using the phone to interact with the Social Security Administration. They are limiting the phone capabilities. They are pushing people online. And then if you can't verify your stuff online, they are pushing you into the office. But at the same time, they're closing offices. So it's creating this perfect storm where you have to be patient if you are interacting with the Social Security Administration, because there's going to be longer wait times, and there's going to be on the phone, you will have to be patient because call times trying to get to a representative has taken hours. In some cases, we've had 3 hours, 4 hours, and then the system automatically hangs up on you, and then you have to call back. So it's causing a lot of frustration. The key phrase here is you have to be patient. So who is affected or not affected? Well, the exempt groups are Medicare, disability, specifically Social Security disability insurance, and SSI supplemental security income applicants are exempt from in-person ID verification requirements. This exemption is designed to ease the process for individuals already undergoing complex application processes. Those already paying overpayment, if you're already on an overpayment payment plan, it means that you got caught up in an overpayment situation, you have set up a payment plan with the Social Security Administration, and you're currently paying it as agreed, then you're okay and exempted from the new policy that is going to effect on March the 27th. If you haven't and you have a new overpayment case after March the 27th, then this 100% policy applies to you. Now, there's also an exemption for survivor benefits. Further exemptions may be announced for elderly surviving spouses filing for survivor benefits. SSA is considering, it hasn't been done yet, expanding the exemptions to further minimize disruptions for vulnerable populations during difficult times. And then those who do not have to take any actions. Beneficiaries already receiving payments do not need to visit SSA offices or provide additional verification. This is very, very important. If you're currently receiving Social Security benefits and there's no problem with it, you don't have to comply with these new rules. Now, when current beneficiaries must visit Social Security offices, so if you're currently receiving benefits, there are certain circumstances that require you to visit the Social Security office under these new rules. Let me explain those specific cases. Number one, starting April the 14th, current beneficiaries who cannot use their online My Social Security account to change direct deposit information must do that in person. And then second, if for any reason you have to verify your identity, existing recipients who need to verify their identity and cannot do so online will be required to visit Social Security offices. Now, exemptions for vulnerable groups, as I mentioned, Medicare, Social Security, disability, SSI recipients are exempt from in-person verifications. And if you have to go in person, you have to schedule an appointment. Call the 800 number, be patient, and you will get a representative that will help you schedule an appointment to your local SSA office. Now, check to make sure that your office is still there, because they're closing offices and the one in your neighborhood or your city may be closing. So you have to go to the nearest one that is closest to you. So just make sure that your office is still there. Now, how can you prepare to avoid having to go there in person if you are receiving benefits? The first thing is to create a Social Security account, and this applies to those who are not currently receiving benefits. Create a My Social Security account on ssa.gov to access and manage your benefits digitally. Now, you can also get ahead of it and verify your identity online using login.gov and id.me. I had to do this in order to access my Social Security record. I wanted to see, where am I in, and making sure that everything that I've paid into the system is correct. And I had to use id.me. It is a slightly complicated process where I had to get on video with a live person to verify my identity that I'm who I say I am. And then after that, then I could log in to Social Security Administration and even the IRS website with id.me. So it can be done if you are challenged digitally. If you have a problem navigating things online, get somebody you trust, maybe somebody in your family that you trust that can help you go through the process. And then you have access to your Social Security information online. You can review your benefits. You can, if there's something wrong with the benefits, you have notifications online. And most importantly, you can review your earnings record to make sure that everything is accurate, because that is how your benefits are calculated. And then ensure that your number and your email addresses are current with the Social Security Administration online, so that you will get the right information that you need when you need it. Or if they make changes, they can send you information about it. And then if you opt in for online notices, then you can get things faster versus in the mail. And you may get something in the mail that may require you to come to the office. If you do so online and you get those notices, then you're staying on top of things much faster. Now, what actions do you have to take before April the 14th? Well, as I mentioned before, create your Social Security account online. Whether you're receiving benefits or not, this is a good practice so that you have access to your benefit information. So if something happens, especially if your benefits stop coming because you may be in an overpayment situation, then you can go online and see what's happening right away versus having to go on the phone, schedule an appointment with your Social Security office, wait a couple of days or weeks before you get an appointment to then go in and have to wait because the offices are going to be overcrowded to find out what's happening. You can do all that online if you set up your account now. And then if you have to update your direct deposit information for whatever reason, it's better to do it now, because when the new rules go into effect on April the 14th, the new identification rules will take in effect. And then now you have to go through extra hurdles to get your direct deposit information changed. And right now you can do it over the phone, but it's very challenging to do that. And then let's talk about scheduling an appointment. As I mentioned, there's a lot of things now in terms of Social Security services that require you to go in person, and you have to schedule an appointment over the phone and make sure that you are patient while the process plays out. And then if for some reason you are frustrated with Social Security, your benefits have been canceled, you are trying to get an answer to something that is critical to your benefits, whether to keep your benefits or to get new benefits, contact your elected representative, your congressperson, your senator. All those people can fast track your information to the Social Security Administration, because when they get letters from your congress people or your senator, they pay attention to it more than you writing them a letter or you getting in the phone and complaining, because then you are one of the millions that are on the phone complaining about something. Now, here are the details of the overpayment situation. The SSA will now withhold 100% of monthly payments to recover overpayments made after March 27, reversing the earlier 10% rule. This could cause financial hardship for seniors relying on Social Security as their primary income source. The sudden loss of their full benefit payment can cause difficulty for some people covering living expenses such as housing, food, and healthcare. And the government is supposed to save 7 billion by making this new rule over the next decade. It's not a lot of money, in the grand scheme of things regarding how much money the Social Security Administration pays out, which is 1.7 trillion dollars a year. Trying to recover 7 billion and cause financial hardship for seniors and people on disability over a decade, is that really worth it? But one could also argue that every money they can collect and put back in the Social Security Trust Fund is important. So that is also a valid argument. But if you get into an overpayment situation, you have rights. You can appeal. Beneficiaries can appeal overpayment decisions or request waivers if repayment causes undue hardships. It's important for beneficiaries to be aware of their right to appeal and seek assistance. Now, I have to tell you, very rarely do they waive your overpayment, or very rarely do they approve appeals. There's 3 levels of appeals all the way to an administrative judge, but very rarely do they grant those requests. So go into the appeal process knowing that your chances are very slim, but it's possible if you have a good case to make. Now, regarding people on disability benefits, regular audits to ensure that SSI recipients still meet eligibility requirements are going to be rampant, especially with DOGE and what they are recommending. DOGE is making the Social Security Administration get more aggressive with disability beneficiaries, so redeterminations are routine but may feel more stringent due to increased scrutiny under new policies. Failure to meet updated requirements could lead to benefit reduction or terminations, affecting vulnerable individuals who rely on SSI for essential support. To avoid disruptions, recipients should maintain accurate records and promptly report any changes in their income to the Social Security Administration, and make sure you're up to date with the SSA regarding your income changes so that you don't trip any overpayment requirements, or worse, get your benefits entirely disqualified. So just if you're on disability benefits, you are now going to be under scrutiny because there's a huge belief in the DOGE group that a lot of people on disability benefits are not really disabled and should not be getting benefits. So they're going to target disability a lot to try to save money. Make sure that you're on top of your game, reporting any income changes, any household situational changes that could impact your benefit amounts. So what are the key takeaways from this particular section? And stay tuned, I have more to bring you. In-person ID starts April the 14th. If you're currently receiving benefits and everything is good, you don't have to do anything. But if for some reason you have to go to the office regarding your benefits, especially for direct deposit changes, then you may have to go through the online system, make an appointment before you get to speak to somebody in person at Social Security. If you are applying for Social Security benefits or survivor benefits, then you would have to go through the online verification process. If you cannot, then you will have to go in person to verify your identity. Monitor your payments closely. This is not the time to just let your Social Security deposit just hit and not pay attention to it, because they are collecting overpayments. So if there's a change in your benefits, you need to know now so that you can stay on top of it and get the money that you deserve. And stay updated on SSA notices. Maybe you should sign up online and get notified online. It's faster because they are making changes before they are announcing the changes and sending you letters like they used to do. So a lot of seniors, when they see these videos, are like, I didn't receive anything in the mail. Well, it's because they are making so many changes. They don't have time to send letters in the mail. They will do that later. And then seek assistance if needed. If you are in an overpayment situation and you feel like you are facing a daunting task, maybe they've sent you a bill for $100,000 in overpayment that you have to pay, and that's happened to many people. Get an attorney or get a Social Security advocate that can help you put the best case forward and try to fight it. Now, if you got a surprise check in the mail, some good news, it is legit. Some people, seniors, have received checks in their bank account or they've received checks in the mail and they're like, what is this? Well, I'm going to explain to you what that is about. So the new law that got you that check is called the Social Security Fairness Act. It repeals the windfall elimination provision, or the WEP, and the government pension offset, which is called GPO, which together previously reduced Social Security benefits for retirees with non-Social Security pensions. The repeal ensures these retirees receive benefits they were unfairly denied. Eligible beneficiaries are receiving lump sum payments averaging $6,710 to compensate for lost benefits from January 2024 onwards. They're not giving you anything before January 2024. That's a loss to you. But they are making it up to you by going back to January 2024 and giving you money all the way through February 2025. And then after March, your regular increase due to this law kicks in. So now you get more money on top of that. These payments are automatically processed and deposited into recipients' accounts by the end of March 2025. Retirees, retired teachers, firefighters, police officers, federal employees are under the CSRS, and others impacted by the WEP and the GPO are eligible for these payments. Benefits tied to foreign Social Security system also qualify under the new rules. Starting April 2025, affected retirees will see their monthly Social Security checks, this is key, increase by up to $1,000 or more, reflecting the removal of WEP and GPO deductions. Now, the law removes provisions that reduce Social Security benefit for retirees with pensions from jobs not covered by Social Security taxes. This correction addresses long-standing inequities in benefit calculation. More than 3.2 million retirees, including teachers, firefighters, police officers, and other public sector workers, government workers at state, local, and national levels, these groups often face reduced benefits despite earning pensions through years of service. Payments cover benefits lost since 2024, ensures affected individuals are compensated fairly for the past year of withheld funds. This expedited payment process marks a shift from previous delays in retroactive payment. Beneficiaries will receive larger monthly checks starting April 2025, helping them better manage living expenses and retirement costs going forward. Now, who is eligible? As I mentioned, public sector workers, teachers, firefighters, police officers, and other state and local government workers with pensions not covered by Social Security taxes qualify for retroactive payments under the law. So basically, what happened was that if you paid into Social Security through private sector jobs, and then you also worked for the government and qualified for the government pension, there was a law that was passed in 1983 during the Reagan administration that said you cannot have both. You cannot have a Social Security benefits and then a government pension, even if you paid into both and qualify for both. And that robbed people of benefits that they've earned but were denied or severely reduced. So federal employees under the CSRS who retired are eligible if their benefits were previously reduced by the WEP or GPO deductions. Individuals whose employment was tied to foreign Social Security systems also qualify for adjustments under the Fairness Act. And then spouses and survivors whose benefits were impacted by GPO will receive retroactive payments and increased monthly benefits starting April 2025. How far does the payment go? January 2024 and onwards. So you're not getting anything you lost before that. Average benefit payment for the lump sum is $6,710. It is automatic, so you don't have to do anything. And the Social Security Administration is going to process everything because they have information about everybody who should have been getting money but was not getting money that they deserve. What actions should you take? Well, verify your direct deposit information. Ensure your bank details are up to date with the Social Security Administration to avoid delays in receiving your lump sum payment for future monthly payments. You can also check that your mailing address is current with the Social Security Administration. You can call them or go online to make sure that that is all set. And then if you never applied for Social Security due to WEP or GPO, then you can file your application now with the Social Security Administration. And starting in April, as I mentioned, your checks are going to go up if you're currently receiving benefits, if you were impacted by GPO or WEP. Now, finally, I want to get to something that is really, really critical for a lot of groups of people. If you're on Medicare, pay attention. If you are turning 65 soon, pay attention, because you could reduce your Medicare costs substantially. Let's talk about it. So, in the news, there's been a lot of disturbing news about Medicare. Here, we're talking about 1 million patients that lose coverage because insurance and hospitals are dropping plans. In this particular case, thousands of seniors lose Medicare coverage after 25% of plans leave Oregon. And this is happening across many states. Here, look at Minnesota. Minnesota seniors face Medicare dilemma: stick with doctors or health plans. 5 health systems with Minnesota operations say they will go out of network next year with setting Medicare Advantage health insurance. So, like, there's a lot of activity happening. But why is it happening? Well, 34 million seniors in Medicare Advantage plans face rude awakening. This is all part of the same story. And that is why 90% of seniors are in the wrong Medicare plan. Why? Because Medicare is confusing. Finding the right plan for you, your budget, and coverage you need can be frustrating with so many options, restrictions, costs, and needs that you need to consider from a personal perspective. So, but picking the wrong plan is going to cost you. On average, a couple spends $300,000 on Medicare during their retirement, some of it because they're in the wrong plan. And then it affects your health, because when you need the help and you can't get it because you're in the wrong plan or your plan has been dropped, that could be a problem. So there is help, and there is free, unbiased help. Our friends at Chapter Medicare have helped thousands of seniors get the Medicare benefits they deserve. You have paid into Medicare. Get the benefits you've earned. Chapter can help you. And here are 3 reasons why we are partnering with Chapter. Number 1, Chapter is, one of the only Medicare programs or advisors that is unbiased, free, but also have access to the 24,000 plans. Actually, they are the only unbiased, free Medicare advisory company with access to all 24,000 Medicare plans. So what does that mean, and how does that help you? Well, they have access to everything, so they can see what is in your local area and then help you determine whether it covers your needs, your doctors that you want to be in network, your finances in terms of your budget, and the services that you need. And here's the part that I like the most about Chapter. Their agents do not work for commission. So when they get on the phone with you to help you, they are not trying to push you into the most expensive plan so that they can get the best commission. They are there to look at what is in your area and recommend the best plan that meets your needs. And then the best part, they can save you on average $1,100 a year. So sometimes, depending on your situation, there may be a small window that you can act to switch plans. So call Chapter now at 539-205-2147 and just listen to your options. It's good to know what your options are now and when you can make the change, so that when the time comes, you can make the change, or you may be surprised. You can switch now depending on your circumstances. So it doesn't hurt to call them. So call the number on your screen and they'll be able to help you and help you avoid being one of the 90% of seniors that are in the wrong Medicare plan. They're highly rated, A+ with the Better Business Bureau, lots of 5-star reviews you can read online. So call the number or go into the comment section or in the description to this video, and there is a link and a form you can fill out very quickly, and then they'll reach out to you. Now, if you are on, you're not on Medicare yet, but you're turning 65 soon, or you're a senior that is leaving your job and you're looking at your healthcare options, or you are on Medicare and you're moving out of state, there are rules you need to understand so that it doesn't cost you money, because some of these rules have penalties. So let's talk about it. If you're turning 65 soon, what Medicare rules should you pay attention to? You have a 7-month window to enroll in Medicare if you're turning 65 soon. It starts 3 months before your birthday. So you put your birthday in the middle. 3 months before that, you can sign up for Medicare. And then 3 months after that, you can sign up for Medicare. So there's 7-month period before you turn 65 that you can enroll. It's called the initial enrollment period, or IEP. Missing this period may result in late enrollment penalties. Automatic enrollment. If you are already receiving Social Security benefits before you turn 65, you will be automatically enrolled in Medicare Part A and Part B when you turn 65. No additional steps are needed unless you want to add coverage like Part D or a Medigap plan. If you're still working and have an employer-based insurance, check with your benefits administrator at your work to decide whether enrolling in Medicare makes sense for you. Larger employers often allow you to delay enrollment without penalties. And then avoiding late penalties, enroll on time, even if you are not ready to retire, as delaying Medicare Part Medicare Part B or Part D can lead to lifelong premium penalties. The next situation is if you are retiring soon and leaving your job, Medicare rules you must follow. There's a special enrollment period that you need to pay attention to. You have 8 months after leaving your job or losing employer-based coverage to enroll in Medicare Part A and Part B without penalties. This ensures continuous coverage during your transition. Then there's prescription drug coverage, which trips up a lot of people. You must enroll in Part D within the first 2 months of your SEP to avoid the Part D late enrollment penalty. Now you see why 90% of seniors are in the wrong Medicare plan. There's so many rules. And then there's COBRA and retiree plans. COBRA or retiree health plans do not count as a creditable coverage for delaying Medicare enrollment. So if you get on COBRA, it does not exempt you from getting or your meeting your Medicare requirements. So you have to sign up for Part A and Part B during your special enrollment period. And then ask your employer for proof of creditable coverage if you delay enrolling in Medicare while working. This documentation may save you later because you may avoid penalties later. And then if you're moving out of state, there are rules and there are changes to your benefit that could occur. Pay attention to that. There is original Medicare flexibility. Your original Medicare Part A and Part B coverage remains valid nationwide. So no changes are necessary when moving out of state. It ensures, that you have coverage, but you must make sure that your new doctor accepts Medicare assignment for uninterrupted care. So you have to make sure that your doctor, accepts Medicare in your new place that you're moving to. Then advantage plans are a whole different topic. These plans are location specific. So moving out of state requires enrolling in a new plan during the special enrollment period. Contact your plan provider for guidance on available options. Here's where Chapter can help you a lot. So give them a call. Part D prescription plans. If enrolled in a standalone Part D plan, you may need to switch plans based on your new state's offerings. Here again, Chapter can help you use the SCP triggered by your move to avoid penalties or gap in insurance. And then update your address. Notify the Social Security Administration about your move so that any notices that they need to send you will be sent to the right place if you're moving out of state. But all of these scenarios, whether you are turning 65, whether you're moving out of states, whether you're leaving your job and you're thinking about what is your healthcare options, Chapter can help you with all that. So call them. They can make it less complicated for you. They can walk you through your options so that you can choose the plan that fits your need. The number on your screen, 539-205-2147, or go into the description for the link. Fill out the form. They'll reach out to you. These guys are awesome. They can take care of you. Thank you for watching this video. Until I see you in the next video or the next live. If you are new to this channel, hit the like button, hit the subscribe button. We appreciate your support. Go in the comments. Let me know your city and state where you're watching this video from. And I'll see you in the next video.